Thank you very much, Madam Chair. I appreciate it very much. And I want to preface my comments by saying that I did get the vaccine, both doses. I had COVID in early January, but I chose to get the vaccine after the 90 days. And I've had a very positive experience. However, this is for the panel, whoever would like to ask this question, answer this question. Dr. Jay Carpenter, an internist in my district, has encountered young patients who have been vaccinated, young patients in their early 20s who have suffered from myocarditis. So again, let me pronounce it again, myocarditis, and the inflammation of the heart. So has anyone experienced that? Any of the experts, have they seen this from, again, young adults in their 20s? So who would like to reply to that? Maybe we can get to, if it's applicable, the whole panel can reply quickly. Has anyone seen this?
I would say that it's such a rare reaction that there's still research taking place. And here in the U.S., we have amazing systems that oversee our safety. And so we have the vaccine adverse event reporting system where everyone is encouraged, if they have any type of adverse event from the vaccine, they are to report it there. We have the vaccine safety data link. We've got the clinical immunization safety assessment system. I mean, there's new systems that were put in place just for COVID, VSafe, and the FDA's BEST system is working. So there's a lot of different systems that are out there. And I do feel very confident that we will soon know if there's any type of need for any type of pause. And it makes me feel comfortable that there was a pause on J&J when it was requested.
Okay, anyone else? Anyone else want to comment? Have they experienced this or heard about this? I mean, it's very serious. And I'd like to actually have Dr. Carpenter maybe contact you and maybe elaborate more. Was that okay? Do you welcome that? Okay.
So, Congressman, one of the things I would just add to is with regards to what we noted earlier, that what has been detected is not above the baseline of what we would detect with regards to cases of myocarditis. So, as Ms. Bazzani noted, we're continuing to review that and determine if there is actually any association. But there is not any association at this time.
I appreciate that very much. Now, I understand my chief of staff has been in direct contact with this particular physician and internist, and apparently he's experienced this. His patients have experienced this more than once. So it's definitely worth looking into. Dr. Omer.
We have not seen that locally in our area, but certainly, as has mentioned, the VSafe programs and other monitoring systems, we will continue to look toward those for any and report any side effects.
Thank you very much. Dr. Omer, again, on this topic, given how much information is available, it can be difficult to know which sources of information you can trust. That's for sure, particularly with the internet. How can one ensure that information they find about COVID-19 vaccines is accurate and comes from credible sources?
That's a really good question. So the general public can go to several reliable sources, and such as for the CDC. So the technical documentation from the CDC has been consistently reliable on this issue and others as well. The second thing is professional associations. So we have 20 years of research that shows that in this country, there's a high level of trust in professional associations. For example, when it comes to pregnancy vaccination, American College of Obstetricians and Gynecologists. For pediatric vaccinations, American Academy of Pediatrics. So they're highly, not just trusted, but trustworthy entities, because they go through a very careful, deliberate process to evaluate the risk and benefit. So these are some of those sources that folks can go to. And the third thing is that I mentioned this National Continued Medical Education Program for physicians and providers, other providers. That's one of the reasons why we are doing this, so that primary care providers, frontline providers feel empowered to talk about vaccine efficacy and safety, and in a way that is evidence-based.
Okay, let me make a statement. I know, Madam Chair, my time is finished, but I recommend that our members communicate directly with their constituents. I've had a town hall meeting, it was very successful with experts, CDC and NIH, and they've directly answered their questions. I can't go any further, so I'll submit the rest of my questions for the record. Thank you.
I thank you.